on imaging and taking x-rays, and what I'm holding in my hand here is what's called an intraoral camera, and this will be put inside the patient's mouth so that we can view various things inside their mouth, soft tissues and the teeth themselves. And we'll just take a closer look here. So if you see, you can see that I'm holding that there and moving the camera there, and you can see that I'm holding the camera, and that will go into the patient's mouth and we'll be able to take an image. Okay, and so that's a really useful tool. Okay, so we spoke about the OPG machine, so I'm going to show you that machine now. So this is the OPG machine, and what we would do is position the patient, so they put their chin just there, they bite this little fork here, we position them in the machine, and then it would go round. So just to show you an example of that, how that looks, so we'll take an x-ray, close the door, lead line door, okay, and then we take the image, and then ready to go. The x-ray machine will go round, face, and we would end up with an image. And as I say, that kind of x-ray is useful when examining wisdom teeth and checking the bone levels around the teeth, as well as for implant planning and things like that. There are other imaging techniques that tend to be employed in dentistry, including what are called CT scans, are becoming far more common, certainly over the last 10-15 years, when planning, especially implant cases. There'll be some relatively few these days, but some practices that have CT scanners in there on site. Most dental practice will be referring to imaging centres to have a CT scan. The dosage of X-ray has come down significantly, so for planning implant cases, it's almost become a prerequisite to plan most cases, and that's a very useful tool when planning the implant cases. So imaging in dentistry is very important. Taking X-rays is important. Obviously, there's a risk benefit that needs to be kind of looked at every time you take any form of X-ray. What is the likelihood of getting valuable information for taking that X-ray, as opposed to the X-ray dose that you're giving to the patient? So that's an equation that is always going through a dentist's mind when thinking about whether to take an X-ray. The imaging with regard to video is extremely important when gaining consent from patients, explaining their treatment to them so that they understand. If somebody can see what's going on, it's much easier to visualize what kind of treatment they require, as well as what can potentially be achieved, as well as showing them before and after pictures and things like that. And then you've got the OPG, which is the X-ray that goes all the way around the teeth, and then CT scans, which can be employed for checking various bits of pathology that might be present in the mouth, assessing wisdom teeth, assessing sometimes root treated teeth, and planning implant cases. Thank you.